Welcome back to Newsday. Thank you for staying with us. Now, October is Breast Cancer Awareness Month, an annual campaign to raise awareness about the impact of breast cancer. Globally, breast cancer is the most common cancer affecting women. In 2018, more than 2 million new cases were reported worldwide. Of all regions worldwide, North America has the highest incidence of breast cancer, and overall, new cases of the disease are diagnosed more frequently in countries in developed regions of the world, such as North America and Europe, than in countries in impoverished regions, such as certain areas of Asia and Africa. Now, joining us to speak on the most common disease affecting women is Dr. Mosanya Arinze, a general surgeon and a consultant general and minimal access surgeon with extensive competencies in surgical oncology, especially of the breast and colorectal. Glad to have you join us today.
Thank you for having me.
And we painted the picture about some of the statistics. Let's get into it. What are the statistics truly, or how much of an accurate picture do we have concerning breast cancer here in Nigeria?
Thank you very much. So globally, breast cancer is the most common cause of cancer-related deaths in women. Following the WHO statistics for 2020, about 2.3 million women were diagnosed of breast cancer globally, and up to 700,000 of those women lost their lives. So coming down to Nigeria, it actually remains one of the commonest cause of cancer-related deaths among Nigerian women. And it's said that about 30 women die every day of breast cancer in Nigeria. So putting that into perspective, you can see that it's quite a high mortality figure. And basically, the major reason for this is that most of our women present late when the disease is far advanced and has spread to the rest of the body. And that underlies the reason why we are very passionate about the Breast Cancer Awareness Month.
All right, a lot of monies have been sunk into research for breast cancer over the years, and I must ask, how far are we in ensuring that we can probably eradicate this? Because some people still have this mentality and the mindset that cancer is irreversible and cannot be treated.
Yeah, so to be very honest, you're very correct. And even recently, more awareness and advocacy have been made towards finding the permanent cure for breast cancer. But we know that drug trials and drug development take a long time. And up till now, the treatment for cancer has remained elusive. So our target and direction now is to diagnose these cancers at an early enough stage where treatment can offer these women a potential cure. And for breast cancer, diagnosing breast cancer at the early stage, which is stage 0, stage 1, and offering them the adequate and complete treatment can increase survival rates to up to 95% within 5 years. And that is actually the main focus of most cancer therapists at the moment. Early detection to save lives.
And Dr. Arinze, men can get breast cancer as well, can't they?
Yes, they can, but actually it's what I would say far less common than women. So for every 100 women that have breast cancer, you probably have a man having breast cancer. So it's a ratio of 99 to 1. But when they do occur, they tend to occur in elderly men and may have poor outcome because the man doesn't necessarily have to be looking at his breast most of the time. And that's why we're also advocating that men should also watch their lifestyle and also examine their breast just like any woman does.
So I just want to ask this question because we see things fly about social media every single time about causes of cancer. They'll tell you microwave, probably this kind of polythene bags, probably if you leave a bottled water in the sun and you drink from that bottled water. Talk to us. Demystify some of those myths. What can cause cancer and what cannot cause cancer?
Well, generally for what we call the etiology of cancer, that the causes of cancers, you have what we call the environmental and then what we call genetics. So genetics is what you inherited from your parents or any disease condition that may change the genetic makeup of you, and then increases your risk for developing breast cancer. For environmental or lifestyle includes the things around us, like you said, maybe microwave and all that.
Does microwave cause cancer?
Not necessarily, to be very honest, because the microwave we use in the house are regulated, so they are not the type of radioactive energy that should cause cancer. But if I bring it home to breast cancer, the commonest risk for breast cancer is the female gender. So every woman who is born today has 1 in 8 chance of being diagnosed of breast cancer in her lifetime.
Wow.
That's about 12.5% risk. Not certainty, quite all right, but then risk of developing breast cancer. And so it now means that once a lady is born, if she lives long enough and if the conditions are right, in quotes, that young lady has a risk of about 12.5% to develop breast cancer. Some other factors may raise this risk to about 30%. So if you've had a previous cancer in your lifetime, if you had a previous breast cancer, if there's a family history of breast cancer amongst your sisters, your mom, your aunts, and then some lifestyle factors, so being obese, and then smoking and excessive alcohol intake.
Okay.
And then for ladies that started seeing their period much earlier, probably like 9 years to 10 years, and then continue to see your period beyond the age of 50, these all increase the risk of breast cancer. And then some epidemiological studies have also shown that women who do not breastfeed their children for long, and those who do not have any children at all, increases the risk of having breast cancer. I must say that this is risk, not certainty. So, and that underlies the fact that we need to screen these women often, so that if these things develop, we can then treat them.
Let me just chip this one in, because I'm just trying to dispel some myths here. Some people talk about the size of the mammary gland. Does it have any correlation?
Absolutely not. So breast cancer can arise in small breasts, can arise in big breasts, it can arise in any size of breast.
Okay.
And just like you said too, there was this, about some weeks ago, months ago, there was this trending video about sucking of the breast to prevent breast cancer, and it became sensational. I could say that at the moment there is no scientific basis for that, quite all right. It's only some epidemiological studies have shown that breastfeeding of the child by a breastfeeding mother may offer some protection. So I'm here to
disprove the father.
It's too early on a Saturday for this.
No, I'm just trying to. Thank you very much for clearing this up.
You're welcome.
Now, let's talk a little bit about early detection. Mammograms are not the most popular tests at the moment. Why is that so? Why are women reluctant to go for mammograms? And what are we doing to get women to become more comfortable with checking themselves routinely at home, even if they can't access a professional check?
Thank you very much. I think this is the major fulcrum of the Breast Cancer Awareness Month, which we all know happens every October every year. And in the month of October, we try to create more awareness for people to know the reason why we want them to check their breast. There's a lot of stigma out there and a lot of miscommunication and misinformation. So what we intend to do, or what we do every year during this month, is to let women know of certain low-hanging fruits, things that they can do every month to be able to increase the chances of detecting any problems with their breast. So things like self-breast examination on a monthly basis, so that you know.
Monthly? Wow.
Monthly. So just examine your breast. Choose a particular moment every month, usually maybe after the period or before the period, and feel the breast to know what your breast feels like normally. When you are accustomed to what your breast feels normally, you'll be able to identify if there is any change and then present to your physician. For breast cancer advocates like us at Evercare and other breast cancer associates, we also develop certain programs during this period to encourage women to have their breast examined. So at our hospital right now, we are offering a program that has discounted rates for mammogram and other breast cancer screening programs for the patient. Screening is the main fulcrum for early detection, and this is also dependent on the age of the individual. So for women who are 40 years and above, we encourage you to have a mammogram every year or every other year. And then for those that are less than 40 years of age, to have an ultrasound done on the breast at least every year or every other year. And then get a medical practitioner, preferably a breast surgeon or a gynecologist, to examine the breast every 3 months in this individual.
That frequently?
So for those who have an increased risk, it can be that frequent. But those who do not have increased risk will be just more yearly clinical breast examination. Now, coming to what you said earlier, before now, there have been paucity of mammographic services in Nigeria and other third world countries. But recently, with more investment in health and advances in radiological and technology facilities, we are seeing an uptake, so to speak, of our women adopting these screening services. We still have a long way to go, and that's why we take these programs very seriously every October.
All right. For those out there, talk to us. Early signs and symptoms people should look out for.
Very good. So the commonest presentation or symptom of breast cancer for women is a lump.
Okay.
So any new lump in the breast may be a breast cancer, but I need to stress that not all lumps are breast cancers.
Okay.
And you may not know unless you have yourself checked out by your doctor. So the commonest presenting symptom is a lump in the breast. Other symptoms may be a discoloration of the breast or change in color. So if you notice that one breast is redder than the other, or there's a change in the color of the breast, or a breast is bigger than the other, either on one side of the breast or the whole breast is bigger than the other, that may be a sign that you may have breast cancer. The skin of the breast may look like the back of an orange. We call that the orange peel appearance. That may also be a sign of breast cancer. Other things may include a discharge from the nipple. So only milk should come out from the nipple. So if you are not a breastfeeding woman and you notice a discharge in the nipple, that may be a sign of breast cancer. You may need to see your doctor. The other
There
symptoms,
are some drugs that make women lactate.
Yes, there are some drugs that make women lactate, but at the same time, if those drugs are being taken and you notice they are lactating, you may need to see your doctor so that you don't just assume that is the drug that is causing it. And then if that is the case, an adjustment may be made for those medications, or you could be reassured, but just have your doctor seen to sort it out. You may have a wound on the nipple, or a nipple that is pushed inwards, called a retraction, or has an ulcer or a wound. And then in advanced cases, for advanced diseases, you may have other problems in the body, may have cough, swelling in the axilla, and in very rare cases, the person may lose their life.
All right. Thank you very much.
All right. Thank you for that insight. Of course, October, the entire month of October is dedicated to breast cancer awareness. So, sorry?
It's called the Pink Month.
Yeah, the Pink Month, exactly. We see you with your, I think I need to wear mine as
Yeah.
well. Dr. Mosanya Arinze, thank you so much for your insight.
Thank you for having me.
We appreciate that.